Urinary tract infection. A urinary tract infection, UTI, is an infection involving the kidneys, ureters, bladder, or urethra. These are the structures that urine passes through before being eliminated from the body. There are two types of urinary tract, namely, the upper urinary tract is composed of the kidneys and ureters. Infection in the upper urinary tract generally affects the kidneys, pyelonephritis, which can cause fever, chills, nausea, vomiting, and other severe symptoms. The lower urinary tract consists of the bladder and the urethra. Infection in the lower urinary tract can affect the urethra, urethritis, or the bladder, cystitis. Causes of urinary tract infections, UTIs. The vast majority of urinary tract infections, UTIs, are caused by the bacterium Escherichia coli, E. coli, usually found in the digestive system. Chlamydia and mycoplasma bacteria can infect the urethra, but not the bladder. Other bacteria which cause a urinary infection include the Klebsiella, Enterobacter, Enterococcus, Proteus, Pseudomonas, Staphylococcus, Streptococcus, Serratia, and Candida yeast. Urinary tract infection symptoms. Symptoms of a urinary tract infection depend on what part of the urinary tract is infected. Symptoms of a lower tract infection, urethra and bladder, include burning with urination, increased frequency of urination without passing much urine, increased urgency of urination, bloody urine, cloudy urine, urine that looks like cola or tea, urine that has a strong odor, pelvic pain in women, rectal pain in men. Symptoms of an upper tract infection, kidneys and ureters, include pain and tenderness in the upper back and sides, chills, fever, nausea, vomiting. Upper tract UTIs affect the kidneys. These can be potentially life-threatening if bacteria move from the infected kidney into the blood. This condition, called urosepsis, can cause dangerously low blood pressure, shock, and death. Urinary tract infection test. To confirm a diagnosis of a UTI, your doctor will need to test your urine for microbes. The urine sample that you give your doctor needs to be a clean catch sample. This means the urine sample is collected at the middle of your urinary stream rather than at the beginning. This helps to avoid collecting the bacteria or yeast from your skin, which can contaminate the sample. When testing the sample, your laboratory will look for a large number of white blood cells in your urine. This can indicate an infection. Your doctor will also ask you to do a urine culture to test for bacteria or fungi. The culture can help identify the cause of the infection. It can also help your doctor choose which treatment is right for you. If a virus is suspected, special testing may need to be performed. Viruses are rare causes of UTIs, but can be seen in people who have had organ transplants or who have other conditions that weaken their immune system. If your doctor suspects that you have an upper tract UTI, they may also need to do a complete blood count, CBC, and blood cultures, in addition to the urine test. A blood culture can make certain that your infection hasn't spread to your bloodstream. If a person has recurrent UTIs, a doctor may request further diagnostic testing to determine if anatomical issues or functional issues are to blame. Such tests may include diagnostic imaging. This involves assessing the urinary tract using ultrasound, CT and MRI scanning, radiation tracking, or X-rays. Urodynamics. This procedure determines how well the urinary tract is storing and releasing urine. Cystoscopy. This diagnostic exam allows the doctor to see inside the bladder and urethra with a camera lens, which inserted through the urethra through a long thin tube. Common medications for urinary tract infections. The following antibiotics can be used to treat urinary tract infections. Methenamine hippurate. A 1996 study showed that methenamine could be helpful in the prevention of infection. Cephalosporins, cephalexin, Keflex, among others. Trimethoprim sulfamethoxazole, Septra, Bactrim. Nitrofurantoin, Macrobid. Quinolones, ciprofloxacin, levofloxacin, amoxicillin augmentin. Ceftriaxone, Rocephin. Cephalexin, Keflex. Ciprofloxacin, Cipro. Fosfomycin, Monuril. Levofloxacin, Levaquin. Nitrofurantoin, Macrodantin, Macrobid. Trimethoprim sulfamethoxazole, Bactrim, Septra. Which medication and dose you get depends on whether your infection is complicated or uncomplicated. Uncomplicated means your urinary tract is normal. Complicated means you have a disease or problem with your urinary tract. To treat a complicated infection, your doctor might prescribe a higher dose of antibiotics. If your UTI is severe or the infection is in your kidneys, you might need to be treated in a hospital. Foods and supplements for urinary tract infections. While doctors will almost always recommend antibiotic treatment for UTIs, there are also complementary supplements for UTI pain and discomfort relief that can help until the antibiotics kick in. These may include the most commonly used supplements to help prevent a urine infection are 1. Cranberry. Cranberry supplements may also be helpful in the prevention of urinary tract infections and are cost-effective. Molecules inside of the cranberry fruit help prevent, specifically, the E. coli bacteria from sticking to the bladder wall. 2. D. mannis. A 2014 study, which used a combination of D. mannis, cranberry and the probiotic lactobacillus, showed benefit in preventing urinary tract infections. Another 2014 study in the World Journal of Urology concluded that D. mannis significantly reduced the risk of recurrent urinary tract infections. Suggested dose: 1,500 mg 1 to 3 times per day. 3. Vitamin C. Vitamin C also reacts with nitrates in urine to form nitrogen oxides that can kill bacteria. It can lower the pH of urine, making it less likely that bacteria will survive. A 1997 study in urology showed oral vitamin C could be helpful in killing bacteria in the urine. Suggested dose: 500-1,000 mg daily or twice per day. 4. Melatonin. Secreted by the pineal gland after the sun goes down, melatonin is a hormone that makes you sleepy. It might also help in preventing a urinary tract infection according to a 2015 study. Suggested dose: 3 to 10 mg each night. 5. Vitamin D. Studies have shown that vitamin D has antibacterial properties. When blood levels are adequate, the body makes a protein called AMP, antimicrobial peptide. AMP prevents bacterial infections and possibly is effective against urinary infections, according to a 2017 study in Frontiers in Microbiology. Suggested dose: 2,000 IU to 5,000 IU daily. 6. L-Arginine. L-Arginine may be helpful in the prevention of urinary tract infections. Suggested dose: 500 to 1,000 mg once or twice per day. 7. Fruits and vegetables. A balanced diet that includes loads of fruits and vegetables is sure to keep you healthy and prevent conditions like a UTI. Include green vegetables like spinach, bottle gourd, etc., and fruits like oranges, kiwi, mangoes, banana, etc. in your diet. These foods provide your body with the nutrition it requires and can help you stay healthy, prevent such conditions. 8. Marinda Citrofolia. This medicinal plant has been used for thousands of years by traditional Chinese medicine (TCM) specialists. It is estimated that there are over 100 active ingredients in the herb. A 2017 study showed the combination of D. mannis, NAC, and Marinda was useful in the prevention and treatment of urinary tract infections in women. 9. Berberine. According to a 2016 study in microbiological research, berberine has also shown beneficial in killing a common bacteria, Enterococcus, which causes urinary tract infections. Suggested dose: take as directed on label. 10. Garlic. Garlic, a vegetable, is known to have antibacterial properties. In those with recurrent urinary tract infections, routine consumption of garlic is often considered. 11. Uva, also known as Berberine. This herb has been approved by the German Federal Institute for Drugs and Medical Device for urinary tract inflammation and is available by prescription in Germany. Other studies also have shown benefit. 12. Drink cranberry juice. Cranberry juice is one of the most well-established natural treatments for UTIs. People have also traditionally used it to help clear general infections and speed up wound recovery time. Studies on the effectiveness of cranberry juice for UTIs have had mixed results. According to one review, cranberry juice contains compounds that may prevent E. coli cells from attaching to cells in the urinary tract. Cranberry juice also contains antioxidants, including polyphenols, which have antibacterial and anti-inflammatory properties. There is no set guideline on how much cranberry juice to drink to treat a UTI, but a common recommendation is to drink around 400 ml of at least 25% cranberry juice every day to prevent or treat UTIs. 13. Use probiotics. Beneficial bacteria, known as probiotics, can help keep the urinary tract healthy and free from harmful bacteria. In particular, a group of probiotics called lactobacilli may help with treating and preventing UTIs. They may do this by preventing harmful bacteria from attaching to urinary tract cells, producing hydrogen peroxide in urine, which is a strong antibacterial, lowering urine pH, making conditions less favorable for bacteria. In a 2016 study, 38 women with recurrent UTIs took vitamin C, probiotics, and cranberries 3 times daily for 20 days, then stopped for 10 days. They repeated this cycle for 3 months. The researchers concluded that this could be a safe and effective treatment approach for UTIs. 14. Honey plus lemon water. For instant UTI relief, start your day with a glass of lemon water. Add honey to the mixture. Lemons are known for flushing out the toxins. Therefore, lime juice is a must-have to get rid of urinary tract infections. By acting as a diuretic agent, lemons allow expelling urine frequently. Rich in ascorbic acid, lemons make the urine acidic and prevent bacteria from multiplying. 15. Dark chocolate. Dark chocolate always has the upper hand when it comes to treating menstrual cramps and improving reproductive health. It is also one of the best foods for UTI. Rich in antioxidants like polyphenol, it reduces the risk of infection. 16. Pomegranate use. Pomegranate is rich in antioxidants that flush out the bacteria. It also contains vitamin C that boosts your immune system for quick recovery from UTI. This juice should, therefore, be an essential part of the UTI diet. 17. Bananas. Bananas encourage bowel movements and create pressure in the urinary tract. Fiber-rich foods are must-have like bananas. Legumes help you fight off UTI infections. 18. Buttermilk. Buttermilk is an essential constituent of the UTI diet. Not only is it acidic, but also quite soothing. Drink it 2 to 3 times a day to get rid of UTI infections. You can also apply or rinse your private parts using buttermilk. It acts as a natural healer. 19. Coconut water. The benefits of coconut are tremendous. Coconut water has a lot of antimicrobial, antifungal properties, which makes it a must-have for treating UTI infections. Its healthy fatty acids can help invade bacteria like E. coli, thereby making them effective against UTIs, stomach ulcers, and other diseases. 20. Baking soda. Baking soda is known to neutralize the acidic nature of urine. It also helps in detoxification and prevents the infection from spreading. Baking soda cream with tartar is good food for UTI. 21. Milk. Urinary tract infections can be cured with milk. It lowers the severity of illness and can help you get rid of UTI if taken on consistently. This is one of the topmost food items, which is considered as the best UTI diet. 22. Fiber. Lack of regular bowel movements can cause pressure in the urinary tract and block urine flow, allowing bacteria to grow. A diet high in fiber paired with drinking enough water promotes healthy digestion and regular bowel movements. Foods to avoid when you have urinary tract infections. 1. Sugar is a great food source for bacteria, but not good to eat when you have a UTI. You should avoid sugary foods such as cookies, soda, chips, candy, cake, and foods with starch. Your urologist will likely inform you of these types of foods, but it's best to be aware of them if you're feeling any discomfort in your bladder. If you believe that you might be experiencing symptoms of a UTI or are recovering from a UTI and have any complications, do not hesitate to speak with your local doctor and urologist. 2. Caffeine. Coffee and soda are leading culprits when it comes to making life miserable with UTI. The reason being is that caffeine can increase the rate at which you urinate, which has 2 problems associated with it. If you proceed to urinate frequently, you're bound to experience slight dehydration in your body, resulting in salts in your urine. These salts can irritate the bladder and worsen the symptoms of UTI. On the other hand, you may find yourself holding back the desire to urinate. If you are in this category, you run the risk of increased bacteria in the bladder. 3. Acidic fruits and spicy foods are the solid items that you should avoid. Lemons, oranges, grapefruits, apples, peaches, you name it. Any of these fruits are loaded with acids, and while they may taste delicious, they can greatly irritate the bladder. A word of warning is to also avoid the juices made from these fruits. In the case of spicy foods, the same logic applies. Adding heat to your food may be a favorite of yours, but the irritation it can cause will put you in great pain. 4. Coffee, a common stimulant and irritant of the bladder. Caffeinated beverages like coffee are probably not your BFFs if you're battling recurrent UTIs. One study found that women who increased their coffee consumption by 2 servings a day had a 64% higher risk of urinary urgency, while women who drank caffeinated soda also had urgency and urinary tract symptoms. 5. Alcohol, a common diuretic. Alcohol can create large volumes of urine quickly that may irritate the bladder and weaken your pelvic muscle tone. For days when you feel the UTI coming on, try cutting back on the fun juice and volunteer to be the DD for the night. 6. Spicy food. If it burns going in, it could burn coming out. While not everyone is sensitive to heat, spicy food can irritate the bladder, worsening an already unpleasant bathroom experience. Try dialing it back on the hot sauce at your favorite Mexican joint and choose neutral herbs like rosemary and thyme in your food instead of black pepper, cayenne, and red chili pepper flakes. 7. Diet soda. Diet soda is probably the worst thing you can drink when you're struggling with a UTI because it has caffeine, bubbles, and artificial sweeteners. Like some of the other ingredients on this list, low or no-calorie sweeteners like aspartame tend to cause bladder pain for some, so it's best to stick to plain water or tea whenever you can. 8. Beer. Alcohol, particularly beer, may cause irritation in your bladder and even worsen the infection. Hence, you should avoid alcohol and other caffeinated drinks, especially when recovering from a urinary tract infection. UTI symptoms may worsen after drinking alcohol. So if you like this piece of health information, kindly subscribe to my YouTube channel.